Welcome to everybody. In particular, welcome to my fellow trustees. Apologies for absence from Sean Dubu and Colin Batten, who couldn't be here. And some trustee matters. We say thank you to Ed Stevens, who has now served 2 3-year terms and will be standing down. And we thank Ed for his very significant contribution. We welcome Eleanor Bulmer as a new trustee standing for election, who is going to bring us significant experience and expertise on the health side in our marketing areas. And I am pleased to say the results of the postal online ballot for Eleanor's position were 34 votes in favour, 1 vote against, with no preferences expressed. So Eleanor's appointment is confirmed. We also welcome Denise McClellan, who has taken on an advisory role to the board. Denise has significant experience within the Department of Health and the NHS. She's latterly the ex-chief executive of a large NHS trust. Denise will act as an advisor and will not therefore carry the legal duties of a trustee, but she's going to make a valuable contribution to our work through her advisory role and membership of the Healthcare Services Subcommittee to the board. We will be taking minutes of this meeting via the recording taken by a colleague. So now let me actually say the minutes of the last meeting have been circulated to all registered participants with your joining instructions. It's a long time ago, I know, but are there any matters of accuracy or amendments required that anybody wishes to raise or record? I'll hold for a second to allow anybody to put something in the chat. No? Okay, then we formally resolve that the presented draft minutes are an accurate record of the meeting held in September 2022, and I will pass over to Sonia to take us through the Chief Executive's report for 2022-23.
Thank you, Roger. I am just getting the slides to show. So I'll go right the way back, otherwise I'll be doing Jonathan's piece for him. Good afternoon, everybody. As many of you know, I'm Sonia Chaudhry, Chief Executive, and I always find this part of the AGM a little bit odd because we're looking back at a year that ended in March, and that's quite a long time ago, and lots has happened since. So I'm going to share with you just some key highlights from the year 2022 to 2023. So we're an organisation for people with ME, run by people with ME. The majority of our trustees have direct or indirect lived experience of ME, either themselves or through a close family member. And many of us in the organisation have the same. We very much focused on people, and we spend a lot of time listening to the feedback that we get from individuals, the good, the bad, and the ugly. And you'll see in the annual report that we've had some fantastic feedback this year. We've also learned from the less good feedback that we've had. We've undertaken a wide range of work, and so I always feel that I'm doing a bit of a disservice to my colleagues when I only pick out a few areas of our activity during the year. It was a year with many challenges, but there were also many successes, and I want to start by talking about our information support and advocacy service. The whole purpose of our services is to improve lives. We know there are limitations about what can be done. We know there aren't treatments, there aren't cures, but there are things that the team do to support people to live with ME, to respond to crises, and to help secure the support and care that individuals need. As you will see from the screen and in the annual report, we dealt with over 3,000 requests for support through that service. Despite many challenges that we experienced in our advocacy service, over 70 adults received individual one-to-one advocacy. And the majority of the people we support through that service have severe or very severe ME. And some of our individuals have over 100 hours worth of support during their advocacy experience with us. So that means our numbers are maybe lower than we would ideally like, but we felt it's very important to make sure that we are there and we manage appointments in very short bursts, and that we respond to the needs of those individuals. We ran a self-advocacy workshop which had fantastic feedback, and we were delighted to launch our Listen to ME service, which is run by volunteers. I want to pick up the work we do with children and young people and families. We provide family support, we provide advocacy for children and young people, and we have a whole range of other services like pen pal services and birthday cards that go from other young people to children with ME. We were really pleased in our first year of healthcare services after we merged with the former ME Trust in February, sort of 18 months ago. As you can see, it was a successful year despite a number of difficulties, like only having one doctor and having to settle into a different way of working as one organisation. We recently said goodbye to Helen Winning, who was the former chief executive of the ME Trust. And Helen always said she would stay with us for a year to settle healthcare services in and to help us launch. And so we're very grateful for everything that Helen has done. And also Jane, who left us yesterday. Despite having challenges with the number of doctors, we were still able to offer 73 people GP consultations. And you'll see that we also provided a range of other consultations through our counselling, our multi-faith chaplaincy and physio for people. And we provided £10,000 worth of bursaries to make sure that people could access the healthcare they needed through us. It was a very busy year on the research side, not least because we launched the Top 10 Plus priorities through the priority setting partnership. And we worked very closely with a very committed group of people with lived experience and clinicians. So we're very grateful for the work that they did. We launched the Decode ME study, and I will say a little bit more about that later on. We also launched the Genetics Centre of Excellence in partnership with Edinburgh University, and this was very much to help catalyse research. We know there isn't enough research, we know there isn't enough research funding, and we know there aren't enough researchers. And what we're aiming to do is to try and tackle that from the bottom up. And again, I'll say a little bit more about that later on. To launch that, we held a genetics symposium at Edinburgh University, and films were available afterwards. We funded 2 new PhD studentships, and you can read more about those on the Action for ME website. And I just want to say congratulations to Josh, who was our PhD student at Edinburgh University, who not only passed with flying colours, but he secured a fellowship in the States and has been able to stay working in the field of ME. And he's exactly the kind of early stage career researcher we need in this field. We worked with PhD students to help establish a Future Leaders Network, and we launched with a summer school up in Edinburgh where they all came together, and we had a series of sessions, and we funded 2 of those individuals to do an internship in the States with Dr. Dan Peterson. We also invested in capacity in our internal team. We're really hoping that by doing that, we can build new relationships, partnerships and collaborations, which will help us achieve the growth that I mentioned earlier. And finally, but not least, our work around establishing a national delivery plan for ME CFS. We were able to present the top 10 research priorities. Myself and one of the PSP steering group, Debbie, went along to meet with then Health Secretary Sajid Javid and others to present the top 10 research priorities and to explore what needed to happen next to turn those into actual research. And that then led to the announcement of the delivery, well, that was part of leading to the announcement of the delivery plan on the 12th of May in 2022, World ME Day. We've continued to provide secretariat support to the all-party parliamentary group. That work is jointly funded with by the ME Association. And in our work leading to the delivery plan, we very much focused on ensuring awareness and understanding, and we take a sort of approach publicly to that because there are politicians, there are doctors, there are teachers and others within wider society that will see articles, will hear about ME on the radio. So during the year, we commissioned an agency to help us with our public affairs and our press media work called Connect. We were able to reach around 75 million people through our interviews, press coverage, etc. We had quite a number of sort of articles and features in the national press. Action for ME was mentioned in 5 parliamentary debates, and we've had a huge series of meetings with MPs, with peers, and with MSPs. Scottish members of Parliament, and that's really important to make sure that ME stays at the forefront of policy and political decision making. I have to say, nothing ever moves quickly enough. People have waited decades for something like the delivery plan, and despite all of our work and the work of other ME charities and committed politicians, etc., we all want to see this speed up. And then lastly, we undertook some work to look at how the revised NICE guideline was implemented, and Connect supported us to undertake a freedom of information request. Thank you. Now going to hand over to Jonathan, who's going to give the Treasurer's report.
Thanks very much, Sonia. Hello, everyone. I'm Jonathan Manuel. I'm Treasurer of Action for ME. If you want. Okay, so an interesting start in the sense that, as you can see from the numbers, if we look at the previous financial year to the one that we're focusing on in 2021-22, we had, as many of you will remember, a significant legacy that boosted our income and has enabled us actually to focus on some of the work that Sonia has described. And so what that means is that after making a very significant surplus in that year, as Roger said, we moved into the financial year just gone with a planned deficit, i.e. it was an investment year, and that investment took a number of different guises, and I'll come on to that in just a moment. But just so that you can see the numbers, I guess, or I know they're in big blocks there. So in the financial year we've just gone, 22-23, our income was 1.8. Our income was 1.1 million, and our expenditure was 1.8 million. So that left us with a deficit of 0.7 million. Thanks, Sonia. Do you want to? Yeah. Okay, so in terms of where did that 1.1 million come from? Well, as usual, apart from the previous financial year, which is a bit of a one-off, the bulk of our income comes from voluntary income, and I'll come on to that in just a moment. But we also have charitable activities, and we have some other income that comes in and to support our overall performance. But let's move on to the big piece, which is voluntary income. So voluntary income, again, we can see that is dominated by donations, and of course we're always grateful in terms of everybody that donates to Action for Me and helps us to do the work we need to do. One you will have heard of quite a lot, and you will see in the annual report, is the Big Give, which was around, I think, 125,000 of that 444 donation income. But you can see also trust income is very important. And if we look at, yes, legacies is much smaller than the previous year, but still important, along with actually things like the tax we recover on the income we receive. So a number of slices to that particular pie, but of course, overall, total donations, a significant part of our overall income. Okay, so in terms of, well, okay, so we had that's our 1.1 million of income. In terms of, okay, where did we spend that money? Well, this is probably not too illuminating a graph, but it does essentially say a huge proportion of that is spent on the charitable activities with a little slice there that's helped support some of our fundraising trading activity. And then, of course, there's the overall cost of generating that voluntary income in terms of staff, etc. In that we saw in the previous slide. So, but perhaps we move on to the next one, which is a little more helpful. Okay, so again, sort of bringing it back to what Sonia was talking about earlier, you can see here that our 1.8 million has been split into 3 broad parts, and within that, we're also if you think about it, I know you don't see it on this chart, but what we're investing in each of these is our staff, as well as the specific elements that are included here. So if we take, for example, the information and services, for example, that includes healthcare spend, and we look at campaigning. Well, we heard about the National Delivery Plan, but a lot more besides in terms of our activity to help better understanding of ME, and in terms of research. Well, there's a lot of research activity. Again, you heard from Sonia about that in terms of the Decode ME and other such activities, and we've got the Centre of Excellence, etc. So on the one hand, you may, sorry, do you want to go back just for you? On the one hand, we'd say, oof, gosh, there's a 1.8 million spend, 1.1 million of income, but bringing your minds back to the legacy that came in before and the reserves that we already had in place, this was a deliberate decision to actually invest for the future and invest in some of to try and really bring forward some of those activities that that we've just described, that Sonia just described. Okay. So what does that mean? Well, actually, this still says that, and again, you think, oof, deficit, what does that mean for our reserves and the financial stability of the overall organization? And what this chart says, and you'll see a bit more of this in the annual report, but what this chart says is that actually we still have a very healthy position. So again, just to sort of try and put some numbers around this for you, the 3 blocks, if we look at 2022-23, what is our overall reserve position says that we have 500,000 of general reserves, which is the orange block. We have 200,000 of restricted, which is the yellow, and we have 700,000 of designated. And if we look at that in total, and again, you'll see it in the reserve, is that we actually hold, our policy is to hold between 4 and 12 months of effectively unrestricted operating costs, i.e. to hold enough to keep to hold enough so that we more than cover the organization's costs, unrestricted costs, for a period of 4 is reasonably standard. 12, it has become more of a norm in particularly in this sort of challenging economic environment. So what we do is we've effectively set a range, and we're holding around based on this graph, we're holding around 10 months, which is given the economic climate, given everything that's going on in terms of cost of living and everything else, is a strong position. In terms of that, and you say, okay, that's fine, but quite a lot of that is designated. Well, of course, that's because like this year, we still want to continue to invest in our in the activities that we describe, and very much that designation is around research projects, ongoing in terms of the Centre of Excellence, and other related activities. The other piece to say on our reserves, which means that we can continue to invest, is that unlike many organizations, our reserves are relatively liquid, and so the bulk is very much cash, and therefore we are able to continue with our work without, for example, like others may have to do, which is to sell assets, which again in the current market is quite challenging. So while we have a very strong eye and focus on moving ourselves back towards a balanced position, because clearly in the long run, it is not sustainable to continue to spend so far ahead of our income in terms of that investment mode that we had for the financial year just gone, sets us up in terms of our activities moving forward while we balance that financial position. So, and I think that probably covers, I think, the main messages that I'd like to give on the performance of Action for Me and the financial position as at 31st of March 2023. Thank you.
Thank you, Jonathan. And there was a comment in the Q&A saying how helpful the slides were to see the graphs, particularly when brain fog is an issue. So I think I've jumped in, haven't I, Roger?
Sonia, you should go ahead.
Okay, thank you. Sorry, I'm just so eager to tell everybody about the work we're doing. That's what it is. Having disrupted the agenda, I will share with you some of the work that we're doing over the year ahead. And as I said earlier on, I can't possibly cover everything that we're doing, but we set out our plans for our work for the next 5 years last year. And so I'm going to share with you some of the work that we're doing under each of the 4 ambitions. And I want to say that these ambitions were to be delivered over the 5 years. So we're not doing everything this year, just as we didn't do everything last year, but we hope at the end of the 5 years, we'll have achieved everything that we set out to. So in terms of improving lives, we want to continue to grow our support services. The team works so incredibly hard, answering phones, emails, etc., responding to queries, making sure that information is always up to date, that our resources are available online. And but we know that there are many more people that could potentially access our services, and we've done a lot of work to try and reduce waiting lists, and we're very much keen to reach more children and adults with ME and their families. That obviously takes resources, and so that has to be a priority for us. We really want to specifically focus on those that are currently underserved. We know, say, through our advocacy service, we're reaching more people with severe ME, and we work closely with other organisations like the 25% group and others. But even if you put all of us together, there's still not enough capacity to reach the need that is out there. And we want a specific focus on people from Black and other minority ethnic groups. So we're looking at developing some work in a pilot area in the east of London. And we've started exploring with some of the local community groups what that might look like and how we can take that work forward, including how we fundraise for that. We're doing a lot of work developing a hospital pack with a few of the other charities. So for people with ME, when they go into hospital, what information do they need? What do they need to share with professionals? And also updating the guide that we produced for children and young people's social workers. We will continue to grow our work around our online forums, our workshops and our podcasts. And I'm really pleased to tell you that our podcasts around education funded in Scotland have been funded for a further 18 months. In terms of our healthcare services, we've had our first year to really settle ourselves into launching the provision that I talked about earlier. And so now there is a real focus on how we evaluate what we're doing, how we measure the difference that we're making for people, and how we continue to improve our services. The team, along with some of our trustees and others, are coming together to look at our plan to grow healthcare services. We know that the NHS provides fantastic services for some, but it also there are lots of gaps for others. And we don't want to duplicate what the NHS is doing and should be delivering, but equally we are here to support people. That is our history. And so we will continue to deliver healthcare services to those that need it for as long as it's needed. And we will have some hard decisions to make about how we actually expand our healthcare services, whether or not we can fund 100% bursaries for those that can't afford to pay for access to our healthcare services. But one of the things that we are hoping is that we will be able to launch a new children and young people's counselling service. We've got a substantial trust application out that we should hear back fairly soon. And if we are able to secure that funding, then we will move to setting that up as soon as possible. In terms of our research work, we are working very hard to increase the funds that we have available to invest in research, alongside the capacity within the team to be able to do more. I'm really delighted that we've got a small core group of individuals that have set up what they've called the Breakthrough ME campaign. They're people who have direct experience of ME, but also others who can see the real need that's here and feel that they can contribute to help us raise more money and to expand the research in this area. So I just want to say thank you to those individuals. We really are focusing on genetics research through the Centre of Excellence as a starting point. That's not to say it's more important than other research, but it is a very basic starting point. And we know that there are a lot of gaps in our knowledge at the genetic side of things. And that's really why Decode ME has been so important. But we want to build on that. We want to grow the network of researchers. And I'm really delighted to announce that our first bit of funding that's gone into the Centre of Excellence is for a 2-year fellowship with Chris Ponting and a fellow called Audrey Ryback. Audrey was one of the Future Leaders Network. She was one of the interns that went across to the States, and she's put in a fantastic project proposal, which is focused on the priority number 10 on mitochondria. And I'm going to read this bit so that I make sure that I get this correct. She is looking to identify and characterize factors in the blood that may be responsible for disturbing the mitochondria. And the mitochondria are kind of powerhouses in our cells. And if she is able to identify that this exists, then it could lead to a meaningful diagnostic. So it's fantastic that the number 10 priority is, there's a piece of research that's beginning there. And I know Audrey is going to be looking for people with lived experience to work with her on that project. All of our research now will have patient and public involvement at its very heart. We have learned so much from our PPI, patient public involvement partners in Decode ME, and we want to ensure that the science is better and continues to be better because of input from people with lived experience. So we have a partnership board that we have set up to oversee the Genetics Centre of Excellence, and the majority of members are people with lived experience. I want to say a little bit about Decode ME. We are so grateful to everybody that has taken part in Decode ME so far. And as many of you will know, the closing date for new registrations for people to participate is 5 p.m. on the 15th of November. And if you are invited to provide a DNA sample through your saliva, spitting in a tube and then popping it back in the post to us, the deadline for returning those is the 31st of January. So if you're over 16 years old, you live in the UK and you have a diagnosis of ME/CFS, please go to our Decode ME website and sign up to take part, and tell everybody you know, and ask them to tell everybody they know. The more people we get in this study, the better. And then finally, we are going to continue working with all the other organisations and the government, Department of Health and Social Care, to push implementation against the delivery plan. Many of you will probably know that the delivery plan is out for consultation at the moment. Action for ME is preparing a response. It will be a very specific response because we have input in a number of different ways throughout the development of the delivery plan. So we are going to be very focused in our response. There are lots of things we could cover and lots of things that we might want to say about what's in the plan or not in the plan or what could be better. But we feel it's having a specific focused response is the best approach. We're going to continue to advocate for people with ME and their families through our work with politicians, with others. We know we've got a general election coming up, and so we are looking at how we can best use our limited resources to make sure we get in front of the right people. We have a manifesto on ME, which has been shared with MPs, and we've got a series of follow-up meetings across all the different parties with people. And what we're calling for in that manifesto is full implementation of the delivery plan, and ideally, and what next, to work with doctors and with the ME community to ensure that people have their diagnosis recorded in an appropriate and consistent way on NHS records. There is a primary care coding and a secondary care coding, and this is not always consistent. That makes it incredibly difficult for doctors who are doing a very difficult job in the first place, but it also makes it very difficult for people with ME to get the care and support that they need. So we want to work together to try and redress that. And once we have those diagnoses recorded, enables us to get the data that is helpful to provide evidence for funding applications with government, etc. And we also want to see that research is properly funded. And I don't think there'll be any arguments from anybody. We know that despite everything, there still is not the level of funding that's needed for the quality of research that's needed to help redress the issues that we see and to identify treatments. So we've got a busy year ahead, and we've got a lot of work that we need to do to fundraise, to support all of that activity. As Jonathan said, we're in a reasonable position, but the money goes down very quickly. And so we are putting a strong focus on our fundraising activity to make sure that we continue to be here for you and for others that have ME now, but also sadly those that will get ME in the future. Thank you.
Thanks, Sonia. I think we have one small item of business that was going to interrupt the agenda, but I think we'll put that to the very end. I think it's appropriate now that we take Q&A. There have been a number of questions put into the Q&A function, I'm pleased to say. And so, Sonia, do you want to, I think pretty much they're all for you. I suggest if you read out the question and then respond, that's probably the best way to go.
Yes. So I'm going to take the first question that came in advance from Danny, and he said, at last year's AGM, Sonia, you outlined a plan to work with other organisations to create a pot of funding to fund some of the top 10 plus research priorities, but this hasn't progressed. It's such a good idea, and I'm sure many ME sufferers like myself are desperate to see our charities take this kind of action and not just endlessly wait for government funding. Please, will you revisit this? So it's a really good question, Danny, and I put a lot of time and effort into engaging with others to see if this is possible. And for lots of very valid reasons, the timing wasn't quite right. We haven't forgotten about it. It's still on the table, and we are still continuing to have discussions with others. I think the other thing to say is that we're really pushing the government to look at funding for research. Ideally, we would all want to see a substantial pot that was available for funding the priorities, and that hasn't come through the delivery plan. But that's not to say that discussions still aren't taking place about what can be done. The NIH, our National Institute for Health Research, are commissioning a landscape review, And from that, they will then, we hope that there will be some forward movement in terms of what action will be taken to address this chicken and egg situation of, not getting enough applications in, but not getting enough research funded. And so we hope that that will be helpful. We also saw that the landscape review that came out around rare diseases over the last week or two has got some really interesting information in. So we will be looking at that in comparison to Emmy when the review is completed. So nothing further to report on that at this moment, but great question. I hope I will be able to give you a different answer sometime in the not too distant future. I'm going to work through the questions we've had here through the webinar. Are there any plans to expand the Listen to ME service? My best energy hours are 3 to 6 p.m, which is not when it is running. I'm not aware at the moment that there are any plans to expand that. That's not to say that we wouldn't look at that, and I can go back to colleagues and talk to them about any plans that we have. What we did do when we set up that service was to make sure that we didn't duplicate what is offered by other organisations. And so some of the timing decisions were made around that. So I will go away and find out whether we have any plans, and we will make sure that we provide an update either through interaction or through our website, or both actually. The second question is, are there any plans to add occupational therapists to the healthcare services? At the moment, no. What we're doing, I mentioned in my presentation that we are getting together to look at how we can grow healthcare services. And we ideally would provide a whole range of different disciplines and different support. We don't have the funding for that at the moment. We invest some of the charities' funds to support the healthcare services, and we provide bursaries. So we're going to have to make some quite tough decisions about where we start and what we can provide. Once that plan has been developed, we will make sure we can communicate that across our different channels. And I know that there will be more information in interaction as well for those that aren't online. Next question is, have you made any progress with building relationships with the opposition parties, given the possibility of a change of government in the next 18 months? I touched on this in my last presentation, and yes, we are looking to make relationships across all of the different political parties. The agency I mentioned, Connect, are working with us to do that and are setting up meetings. We also interact with different parties through the all-party parliamentary group, and there's some work that's being undertaken in Scotland. It's being led by my colleague Avril. It's also engaging there. So we are trying very hard to make sure that we engage, not just because of a forthcoming election, but actually the more support, the more people talking about ME in Parliament, more people asking questions, is very helpful for making sure that ME remains, at least as part of the range of topics that are being discussed. The next question, actually it's a comment. Thanks for making this so accessible to attend from bed, really appreciate it. Well, thank you for choosing to use your limited energy to join us today. We very much appreciate it. Comment, great news about the hospital pack, that when this individual was in hospital previously, they were useless about understanding ME. So hopefully we'll be able to launch that in the not too distant future. A question from Liz, would it be possible to explain further about the figure of 50% of long COVID people have ME? Where does it come from? Is it diagnosed by a health professional or who meet nice diagnostic criteria? A very good question. There's a lot of emerging research. There's been a lot of research over the last couple of years about people who have a diagnosis of long COVID and the different symptoms they experience. It's thought that there are around 3 different subsets of long COVID, and one of those subsets are people that without the title long COVID probably would have been diagnosed with ME. So they have ME-like symptoms. Their symptoms mirror directly those that people with ME experience, and most importantly, post-exertional malaise. There are a number of pieces of research that have come out over the last few months that have had figures between 42% and I think 60-something%, and the most recent one was 50% of people with long COVID who've had symptoms for more than 12 months have ME-like symptoms. And that is the figure that Roger referenced right at the very beginning. So if we took 50% of people with long COVID and added that number to the 250,000, which we know is an old figure and is only a prevalence, an estimate, then you get to 1.3 million. So we're keeping a very close eye at what's happening in terms of the research, and also checking back with researchers like Chris Ponting, but also our medical advisor, David Strain. But we talk about ME-like symptoms rather than a diagnosis of ME there, because we know that many people with long COVID who have ME-like symptoms do not have a diagnosis yet of ME because they have a diagnosis of long COVID. So we're keeping a very, sort of close watch on how that progresses. Next question, any particular plans to get seriously big funding, including from government, for things identified in the PSP? I think I sort of responded to that one earlier on, but the other thing that we are doing through our increased investment in our research activity is to think about how we build partnerships outside of government funding. So there are lots of organisations, big pharma, the pharmaceutical companies, biotech companies, those kind of companies that are working in the research space that could be interested in ME, that we want to get to talk with them, to convince them that ME is worthwhile, and a worthwhile area of study, a worthwhile place to put investment, and potentially to work with them, particularly around our sort of focus on patient and public involvement. We fundamentally believe the science is better because of the involvement of people with lived experience. And so we feel that we can bring that experience and work with other organisations. So we are just exploring how we build those relationships at the moment, and we've got a new volunteer that's got a fantastic range of experience in this area coming to support that work for us. And then the last question, and sorry I haven't grouped these, I'm just reading them as they appear. Any plans on finding out the updated figure of how many people have ME? 250,000 is a decade out of date. Absolutely. That's why we really want to focus on the coding that I mentioned earlier. That we're also exploring as part of the Decode ME team what other data we can get access to. We know that we've got electronic healthcare records. We know that there's other data out there, and we're looking at how we can get some data from that. But the key is we've got to get diagnoses recorded. So I hope that figure will be updated. The other thing to say, a few years ago, that when Chris Ponting and I were running an event at the World Health Assembly Summit in Geneva. That's the biggest kind of forum where the global health decisions are made, and we ran the first ever session on ME and an informal event, and Chris came along to talk, and I asked him the question. We've got 500,000 people in the biobank, the UK biobank. It's held by Edinburgh University. Has anybody looked to see how many people in that biobank have said they've got a diagnosis of ME? And Chris messaged a colleague, got the figure back, and by the time we started the event, he was able to say that based on the data that he got back, if you extrapolate it up in terms of the number of people and the population, it was 286,000. I hope I've remembered that correctly. And that is, I think, Simon McGrath published that. So that's, the figure is out of date. 286 gives us an indication. The reality is they are still estimates. Are you involved in the government's COVID inquiry, given the amount of people who have got and are still developing ME because of the spread of COVID? We're not directly involved. We have tried to find a route in, but we do know that our medical advisor, David Strain, continually bangs that drum and has been involved in lots of different areas in terms of COVID inquiry numbers, etc. So David is certainly a good spokesperson for that matter with government and through the inquiry and other routes. Any plans to campaign on the rollout of air purification and ventilation in public buildings and keeping masks in healthcare settings, given the amount of people developing ME due to catching viruses? We do not have that as a plan at the moment. We obviously follow government advice in terms of what's being said. We understand that many of our community are concerned about infection and catching viruses, and we anticipate that will increase as we enter the winter season. We have to make very tough decisions about what we can focus on, and our strategy, what we're setting out to achieve, our ambition, is only as strong as the things we say we're going to do and the things we're not going to do. And already my team will tell you they are spread very thinly, and actually we've got to start being much more focused, and that's my job and my colleagues' management team's job to try and ensure that we focus back in. So we don't have any plans on that at the moment, and I understand that may be disappointing to hear, but I do hope that you also understand that we've had to make some tough decisions about what we don't do as well as what we do. And then the last question is, how do we check we're properly coded on the system? So that's GP healthcare records. Do you have an easy guide of what to say to doctors to check this? That will come. We are planning our campaign. We have yet to start that. We want to do that with people with lived experience, but also with doctors. This is about, one of our values is collaboration. And so we must work collaboratively with all other stakeholders, organisations, the ME community, to make sure that we move forwards together. So we're going to pull that group together, and we will work together to find the best way to make sure that you can, check your coding and can have that conversation with your doctor. And one of the things that we definitely will produce is an easy guide, probably with what you need to ask for, and make sure that the coding is correct and those kinds of things. We're going to focus on primary care as a starting point. The coding, I believe, is different in secondary care. So that more information will come early in next year. And if there's anybody that would like to work with us on that, then just drop us a line, because we will be looking to make sure that we have full involvement of people with lived experience in that process, because we want to make sure that anything we put out for you is easy to understand, it's accessible, it makes sense, and it's short and concise, so that it doesn't use up too much of your energy as well. So Roger, I think that's all of the questions. I think I've answered them all. Have I missed any?
I'm afraid that a further one has come in as you were talking. There's one last one left.
Okay. So last one from Emma. Listening to you talk so far, you all seem to be doing so much at Action for ME to try and help us. Thank you. But why then do you think these big agencies, organisations, etc., do not really listen? So it's another great question. I just don't know, Emma. I know that, you look at the NHS, they're under extreme pressures in lots and lots of different areas. And I fundamentally believe that it's not a case of not caring. Of course, there will be some individuals and some organisations that will be dismissive of ME, but it's 11 years this month that I've been with the organisation. And I have seen a change in how people are talking about ME, how they're opening a door to us to be able to talk about it. I definitely think long COVID and the coverage around long COVID has helped that. But I also think that ourselves and others are getting ME out there much more. It's in the press, people are reading about it, they're hearing about it, they're seeing information about it. They recognise that they know people that have ME that or maybe long COVID. And so I think, we're all challenged, and there are things that we can do and things that we can't do. I also think that government is listening. Now, listening is a start. What we want is action, and our job is to make sure that that action follows. And whilst we have to I kind of want to say bang head against brick wall, and I don't quite mean that. I think people are listening, but I think our job is to be persistent. Our job is to be resilient when we get knockbacks, and our job is to make sure that people with ME, both children, adults, and their families, are represented and advocated for in the best way possible. And I can only reassure you that we will continue to do that.
Okay, Sonia, one last question has come in, and then I think we will then have to call a halt to questions. So,
so we've got Yeah, we've got to thank you and for answering questions. The last question is, any plans on educating medics on the new NICE guidelines, both existing staff and those being trained in medical schools? So there is an action in the delivery plan around that. There's a section that addresses education and training for doctors, for medical students, for allied healthcare professionals. So that work is being developed. We are not directly involved in that, but David Strain is very heavily involved in that. So because it has been picked up through the delivery plan, aside from the podcasts that we're running through the Scotland funding, we're not going to pick that up as an activity. Of course, we will continue to respond to requests. We've got some amazing students at one of the London universities who are holding a charity fashion show for us, and they've asked us, it's the medical school, and they've asked us to go and talk to the medical students, and we absolutely will do that. We'll respond to requests, but we're not taking that up as a major strand of our work.
Thanks, Sonia. Thank you for some great questions. One final bit of formal business to conclude, which was the bit that was going to go after Jonathan's presentation, which is we do need to confirm the appointment of our auditors, Moore Stevens as auditors of the charity, and authorising the Board of Trustees to fix the remuneration of those auditors. So just hold for a moment if anybody has any concerns with that. I'm being told it's no longer Moore Stevens, it's Moore. Okay, we'll take that as confirmation. That's quite important. And then finally, I think it just falls to me to say thank you to a number of people. Thank you to Sonia and Jonathan for their presentations today. Thank you to the colleagues who've worked behind the scenes on the AGM, who put a lot of work in, including Shane, Charlotte and Claire. A very big thank you to the whole Action for ME team, though, who worked so incredibly hard in, frankly, dealing with some challenging problems. I mean, our people with ME, those of you who are watching, you are in incredibly difficult situations, and the Action for ME team are always going to try to be there for you, but it can be challenging as well for them. So I just want to show our appreciation for them. Thank you to my fellow trustees for their support. And thank you to all of you for contributions to Action for ME and for coming and listening to us today. And with that, I'll bring an end to the AGM for 2023. Thanks very much.